three positions for the paracervicals. The uppermost paracervicals, we have the contraction phase for all of them is pretty much the same. You just kind of tilt your nose up and you're pushing into the table or your hand if you want to put your hand underneath it. So just like that, and then relax, and then we have, you're going to cup the occiput, hand on top is going to be right on top of the head. We're going to be tractioning our lower hand, giving traction, pulling, and then pushing down. So basically you're pushing her chin into her larynx. So the thing with this one, if you're finding that you're doing too much axial loading, just do some deep tissue, some soft tissue in the paracervicals in this area. So if they're feeling a stretch, then go for it. But so you're really making sure you're tractioning and pushing down at the same time. So kind of a C motion. You're not jamming the head, loading more. You want to give traction for that. The mid cervicals are similar, but your hand position's a little different. Instead of this, you're going from cupping the occiput just to shifting your hands forward. And again, you're trying not to jam straight down. You're coming in a C curve and pushing in her head into more flexion. Again, the contraction phase is the same, just nose up a little and pushing down straight into the table. So your hand position goes from here to here for the mid cervicals, and then the lower ones is the one where you can get your knee on the table. You put the just distal to your knee is where you're going to be creating the stretch. So you're trying to push down into this space just distal to your knee. So if I wanted to do her mid thoracics, I would come up. I'll have you scoot down just a little bit, and again pushing down into my knees, the contraction phase, and the stretch phase is I'm going to push down just where my knee's ending and put her into flexion. I'm not going to push hard for her because this feels like a chest compression sometimes. I would probably, if this is working for the patient, great. If not, I would just do some tissue work or maybe inversion table, which is gone.
It's in the other room.
Oh, okay. And maybe some stretching, some myofascial release or something different, because that one can get uncomfortable, especially with females. Next.